This will be our last session of the day. So thank you all for sticking with us today. Um, we're just, again, so grateful and thankful that all the participants are here and for our session presenters. So without further ado, I have Sandy Phan and Sara Sisco here today. So I'll hand it over.
Thanks, Shayla. Appreciate the opportunity to bring this session to you again. I'm going to go ahead and start sharing my screen. Hopefully, optimize share sound. Okay, make sure I do this right. We do have a couple videos we want to show, so hopefully that'll work. All right. So yeah, we're Sara and Sandy. Our presentation is entitled Community Transportation Navigators, Amplifying Voices of Hardest to Reach Communities. As I said, my name is Sara Sisco. I use she, her pronouns, and I'm the Senior Manager for Mobility Education Outreach on the Hopelink Mobility Management team. We're located in King County, Washington, or Seattle, Washington, outside of Seattle, and we serve all of King County. And then, Sandy, do you want to introduce yourself?
Sure. Thanks, Sarah. Hi, everyone. Pleasure to be here today. My name is Sandy Phan, and I use she, her pronouns, and I serve as the program manager for the Community Transportation Navigators program, and excited to share a little bit more about that program with you all. And I am also stationed in Seattle, Washington, serving King County, and also went to school at University of Washington, where I studied public health and super interested in supporting the communities and all community engagement.
Great, thanks, Sandy. So just a little bit about who we are, and then we'll dive into the program. Our team, the Hopelink Mobility Management team, is situated inside of a community action agency called Hopelink. And we serve, as a community action agency, we serve a wide variety of programs, including food assistance, employment services, financial assistance, housing, adult education, financial capabilities, energy assistance, and family development, as well as having a really robust transportation department within our nonprofit. And so within our nonprofit, we have three parts to our transportation department, including direct service. So we have a direct operations department. We have a non-emergency medical transportation or Medicaid brokerage part of our department, as well as mobility management. And our vision with mobility management is everyone can get where they want to go and that we see transportation as an essential service. Our goal is to create better coordination through education, advocacy, and coordination around transportation challenges that exist. And so it's kind of just setting the frame of who we are. Our agency has been around since 1971. We're one of the largest nonprofits on the east side of King County. And then we have our Community Transportation Navigators program, which we are incredibly proud of. And I'm really proud to say that we are in year 4 of this program after many years of research and really making some really exciting changes and growth as part of this program. So I'll turn it over to Sandy to talk a little bit about the program itself.
Thanks, Sarah. And for our program, like Sarah said, we've been going on year 4, and we started very small as a pilot program and have grown and multiplied and scaled throughout the years. But at the original plan, our goal and our mission has always been to connect hard to reach community members to trusted transportation sources so that they can increase their access to transportation. And our vision is that the community is equipped with transportation knowledge so that they could ride transit with confidence and independence. And we developed 4 different pillars to kind of help us guide our journey to reach these goals. And the first one is to empower. We have a lot of relationship building that we do with the navigators that build relationships with community members so that they could build long-lasting relationships and provide them the tools that they need to really be open to riding public transportation for the very first time. Our navigators do a lot of one-on-one support where they take community members who've never rode public transportation before and they go on these trips together to common destinations and they show them like all the nuances, which direction you need to get on, how do you communicate with the bus driver that you need to get off, and all the different tools and technologies that you could use to make your rider experience better. And then that helps them be empowered to take these trips on their own where they don't have to rely on a family member or a friend for their travel needs. The second pillar that we've developed is to provide education, and our navigators are able to provide information in real time in their own cultural language so that the community member can ask clarifying questions and have that deeper understanding of all the different transit resources that are available within our complex region. The third pillar is to enroll. And we recognize that a lot of our reduced fare benefits or other transportation benefits in our regions do require some type of application process or enrollment phase. And the communities that we're serving oftentimes do not speak English as their main language. So that becomes a barrier, as well as just going through an application process can be very intimidating and a big barrier for some of these community members. So we train our navigators to go through these portals, helping families, helping individuals collect the enrollment information and eligibility documentations, how to create an account, how to submit applications. And our navigators are able to help follow up through that whole application process to ensure that the client who is eligible for this reduced fare program can get access to it. And then lastly, our pillar is to engage. Of course, our navigators are part of the community, so they're talking to this community and sharing information, but they're also listening. They're collecting feedback from the community members to see what is working really well in the community, what is not working well. And all that feedback comes back to us, and we then share it back to leadership at our big transit agencies.
I'm muted, right? This is me, Sandy. Yeah. So wanted to give a little bit of history of how we got to this point. Like I said, this program is now about almost 4 years old, which is crazy to think that we've been doing this long, considering that we started the research in and of itself in 2018 as part of an inclusive planning grant, where we really looked at how do we bring a bunch of right people to the table to have conversations about what would support better access to transportation in our community. And what arose out of that process in 2018 and 2019 was a desire to have two programs, one being a peer-to-peer transportation support system, and a second to be a one-stop, one-call, one-click service. And so we really looked at kind of how are we going to take on this Navigator program or a peer-to-peer education program. And we had some funds left over in late 2019, and we thought, okay, well, great. We'll run a pilot program. We'll do a really short pilot. We'll go out into the community. We'll recruit community members who want to serve their community. And we recruited 4 really incredible individuals. Unfortunately, we recruited them in late February of 2020 and hired them to do outreach. And so we trained them up in March of 2020, not knowing what was ahead of us. And unfortunately, just with the ever-changing environment, we weren't able to actually pilot that original program. At the same time, in 2020, King County Metro, which is our largest transit agency here in King County, Washington, was partnering up with the University of Notre Dame's Lab for Economic Opportunity to understand why certain populations weren't using bus passes or transit. And they came to us and said, we know that you're doing this, you're piloting this peer-to-peer program. Let's all partner together. So it was us, it was Department of Health and Human Services, I think DSHS. It was the University of Notre Dame's Lab for Economic Opportunity. Like, it was a huge group of people coming together to say, how do we best support these communities that weren't being served? And we identified at that time Somali, Filipino, and Afghan communities were the 3 communities here in King County that weren't using transit effectively. And through a series of outreach, we kind of honed in a little bit deeper on the Somali and Filipino community. And throughout 2020 and into 2021, we did focus groups and surveys where we compensated folks for giving us information about how they engaged with transit and what kind of support services they might want to better access transit. One thing that was incredibly important to us as we were doing this research in 2020 and 2021 was that if we were going to do this research with these communities and we could again get funding to do a Navigator program, that these would be our first communities that we would serve. That was our commitment. We can't ask a bunch of questions, right? Like in public participation, we know that it's so important to not just ask questions and not go back to those communities. So we really wanted to do that. So in 2022, when we were ready to pilot, so when we brought Sandy on, she had been in a different role and kind of transitioned in 2022 to serve this program full time. We went back to the Somali and Filipino communities and said, we want to launch this program. The way that recruitment and everything took shape, we launched in summer of 2022 with 3 Filipino navigators, who we'll talk about in a couple of moments. So it really took us years to get to this point to ensure that we were doing it right, we were thinking about compensation correctly, and that we were being true to the communities that we had asked to give us information. I'll go to the next slide, and then Sadie's going to talk about a little bit about how we got here and the research that we did.
Yeah, thanks so much, Sarah, for that background. And like Sarah said, we really wanted, while we were building this program, to be inclusive and intentional. So even before we started recruiting for navigators to serve this program, we wanted to ensure that the model that we were building was going to be effective. And we took a lot of inspiration from past programs. And the one that we got a lot of the inspiration from is called the Promotores Grassroots Movement in the origin of Latin America, where they started to do grassroots movement and do peer-to-peer education in rural parts of Central America in 1960s. And then we saw that pattern start to adopt to the US model when the US Federal Migrant Health Act of 1962 and the Economic Opportunity Act of 1964 come. And in this photo to the right, this is a cohort of Spanish-speaking natives who were recruited to be the first cohort of promotores to serve King County and provide insurance benefit. So this team, part of the Spanish communities, was not receiving health insurance, and they wanted to increase that count for the county. And they hired community members who spoke that native language to go back out in the communities, host different events, invite people in, and provide education on different insurances, and then enroll community members in that insurance. And we saw a lot of success in this program. So we took a lot of inspiration for this program. And over time, in the 1968, the Indian Health Service also implemented a very similar model and called it the Community Health Representation Programs. And we took inspo from this model where they were doing insurance, benefit, and enrollment and applied it to another topic where we think transportation is not available wide across equitable for community members, especially community members who do not speak English as their first native language. And then Sarah, if you can proceed to the next slide. We also did a lot of research and connecting and partnership development with peer-to-peer programs that already exist in King County with a different focus. And one example partnership we developed was learning a lot from King County Public Health Community Navigators program. And this was a program that was launched in the height of the pandemic during COVID-19, where public health went out and they recruited a lot of different community groups that spoke different languages in the county. And then they trained those leaders to go back to the community to provide COVID-19 pandemic education, as well as vaccination support, signing people up for vaccination, and making sure that the information was being delivered to the communities in a culturally appropriate way, as well as in language, so that they could receive that information during this big pandemic. The second partnership that we developed to learn from is the program where Seattle Department of Neighborhoods, they developed a very robust community liaison program that was created to help the city do a better job of engaging in community members and receiving that feedback to make decisions for the city of Seattle. And they do a wide range of service where they're talking about environmental healthy, food resources, food access, and transportation had not been one of those big categories where we were providing the similar peer-to-peer education. So that's when we saw the opportunity that we could develop some type of peer-to-peer program. And the information that we would be providing is all the different transit agencies and resources available to communities. And we can do that with peers from the communities that have lower access to this type of information. And if you can proceed to the next slide, Sarah. And this is our culture cohort. These are just a couple of the navigators that we have recruited in the past. But the culture cohort, their goal is to serve communities that do not speak English and have lower access to transit information. And anytime we are recruiting a navigator to serve, we make sure that they are part of the community. They have that same shared lived experience to the community that we're serving. They're able to speak that native language, and or they're familiar with that geographic or that neighborhood or region that currently lives, where the community currently lives. And we do a lot of recruitment that's intentional. We do a lot of recruitment through other community organizations that already serve this community. So, for example, the photo on the left is the cohort of our 3 Filipino navigators that served during 2022. And all of them came from some type of nonprofit background. And they still work there. They would work this role as a part-time, but their main role would be to serve at Catholic Community Service, which is a nonprofit organization in King County. So they already come with this lived experience of serving the community. And each one of these navigators have also immigrated to the US during their time and had their own journey of learning and navigating a new system with that immigrant lens, so that they are able now to understand and support other immigrants that are coming to the US and trying to really understand the transportation system that exists. And we've noticed that anytime that there's representation at these larger events where government services are usually provided, but at outreach, when community members are able to see the sense of representation or hear the same language that they speak, they begin to kind of like naturally gravitate towards them and start to ask questions. And that has always been our goal, is to form that trust between community members and the resource where they're learning about transportation. And we've seen a lot of success within the Filipino community. And then we decided that we were going to launch a secondary cohort in 2024, with the focus being on the greater Muslim communities in King County, with a specific focus on women's and moms. And that's when we had the second cohort, which is photographed on the right. And each one of them also come from this lived experience of self-identifying, being part of the Muslim community, and able to reach community members at places where people were already going to. So they were able to do outreach at the mosque. They were able to do outreach at community markets that people were already going to. And we saw a lot of success in that very specific cultural outreach approach. And then after time, we started to launch this program in another category. If Sarah, you want to go on to the next slide. Because we saw a lot of success in the cultural and language community where we were providing outreach and education, we were then approached by King County Metro in 2023 with a new target population. And this was during the time where King County had just launched a new initiative, and it was called Health Through Housing. And Health Through Housing was a huge initiative where the county had decided they wanted to purchase 15 old abandoned motels and hotels and then reconvert them into permanent supportive housing as well as emergency housing for people who were experiencing chronic homelessness. And then they were able to get transition into temporary or permanent housing. So this was this next huge target population that we were intending to serve. And King County Metro thought, because of this peer-to-peer model that was doing really well with the cultural group, they wanted to develop something very similar and have the transportation information be relayed through other navigators that have the same lived experience as a peer of experiencing chronic homelessness. And that was a new population for Hopelink, to really serve and learn about this population to see if we could recruit and build a navigator program and cohorts that could serve the healthier housing community. And with time, we were able to successfully recruit three rounds of cohorts. Our first original cohort was in 2023, and that is the main photograph in the middle. From left to right, we have Lester, Cedric, and Bill. And we were able to find these navigators through other partnerships, and we looked a lot through organizations that were already serving the homeless population, and we were able to learn and meet with them, provide them this opportunity where they could serve a similar community group that they were once from, and then provide transportation information through that way. And after a couple years, we developed the second cohort because there's 15 housing sites and three navigators was not going to be enough to do all of this education and outreach. So at 2025, we did end up with about 9 navigators. We lost a couple due to health and other medical challenges, but our team is really strong and has been serving the health through housing community for a long time. And in these outreach, they're able to provide information, they're able to provide trip planning, they're able to provide transportation benefit cards and helping people utilize them, how to reload them, and kind of trip planning to see what's going to be the best budget and the best options for this community to travel within our region.
Just a huge credit to Sandy for what she's built. She kind of has morphed into becoming the program manager of this role, and a lot of the reason we've had so much success and have not seen a lot of turnover is because Sandy has built a lot of relationships and trust. And so I just want to highlight that as well. She gets a lot of credit for how strong our relationships are with these navigators, and just they come from so many different places and so many different backgrounds that really one of the things that we think is really vital is that relationship aspect of this program. And then we've had a lot of consistency on our internal team, and have been able to grow this program effectively. We currently have there's kind of 3 parts to our funding currently. We receive the bulk of our funding from King County Metro, which pays for our staff time as well as our health through housing navigators. We're super excited that in this last year, we were awarded a Washington State Consolidated grant to provide funding for the cultural cohorts, which has allowed us to, I don't remember if we put this in here later, Sandy, but we currently don't have the Filipino cohort. We kind of retired that cohort. We redid our cohort, our Muslim women cohort, to be Dari speaking, and then in 2 days, Sandy will be launching 2 new cohorts for Spanish speaking and Russian speaking populations, and that's being paid for through the Washington State Consolidated grant, and then our own agency puts in a small portion of money as well. So we're really looking to diversify those fundings. We're really excited that in kind of our new fiscal year, we'll have some additional funding partners. We're always looking for additional funding partners so that we have more communities that have kind of a commitment to this program and really can understand why it's so vital. And this is such a good way for folks to learn and engage. We had a local IAP2 event last night, and we were just talking about all the different types of community partnerships that can exist. And it's nice to see that both our transit agency and our state DOT is investing in this program. All right. And then we currently pay our navigators as independent contractors. It allows for flexibility. It reduces entry-level barriers. And we're currently paying, you have to remember that I want to say this because this often comes up in conversation. We are here in King County, Washington. The local news said that in Seattle, the average price of gas is $5.99. So it is a high cost of living area. So we are paying $65 an hour, up to 64 hours a month for our highest paid navigator. And then we also are paying a commute rate for some of our navigators as well. They have a set number of hours that they can work every single month, but we don't prescribe how that is happening. And we get to set the duration of the contract. It's a really nice, incredibly flexible model. And we really like this model. It's been working really well for us over the last 4 years. Sandy, did we put in here that the conversion that we're doing, or should I mention that really quick?
No, we have not included that,
Okay.
Sarah. So that's
We
like brand new, hot
It's
off the
brand new
press
information. So
information.
when we did this presentation in San Antonio in September, we were in the process of thinking about what would it mean to convert the health through housing navigators to full-time staff. So moving them from this independent contractor model to full-time staff, because honestly, 64 hours a month is just not enough to serve the volume of housing sites that we have, and we want to see growth for that program. The cultural cohorts is a different situation. They're really kind of more ingrained in their community and doing work differently. But as of this week, we have posted and are hiring our navigators as full-time employees with competitive local pay, full benefits. They will become full-time HopeLink employees and will go from having 64 hours a month to 40-hour work weeks. There's a lot more that goes into that. There's a lot more conversations that we've had around, one of the things we called out here is we had waived the background check. We are becoming a fair chance or next chance employer to really look at what do background checks mean and how do they matter? How can we reduce that barrier to folks? We've gone with competitive pay. We've ensured that even the part-time positions that we're offering have health insurance. So we've been really thoughtful in the way that we're doing this. So that is launching in May. Next time you see us, we'll have grown our team by 4 people. We're really excited and really proud of the growth of this program. And I'm going to go ahead and share a video from one of our original cohort members. This is Bill Nichols or William Nichols. And should I play the video, Sandy?
Yeah. A little bit from Bill's experience.
My name is William Nichols. When I first came to Seattle, I knew nothing about Seattle. I was like, okay, I gotta find out this, gotta find out that. Didn't have a place to live. I came up out of homelessness. And the best way for me to get around and get things done is what? Public transportation. So I delved right into it in all aspects and got to know it pretty good. I mean, real good.
And what drew you into a role like this?
I enjoy helping people. Me being less fortunate at one time, I know what it's like, what they're going through, what they're facing, and it was pretty easy for me to deal with them head on. What their problem might be, or how to help them out, because I've already exhausted all those problems. You got to get down to their level and let them know that, hey, I'm right there with you. At first, it might be a building of trust thing, which doesn't come overnight. For me, just being a navigator, it's a natural thing because I do use public transportation every day. Transportation is very important to me. Having the different modes that we have here in Seattle, which is terrific, enables me to go anywhere I want, anywhere.
So that's Bill, one of our original cohort members. And Sandy, you want to go through this slide?
Yeah, I can go through this slide. One of the things that we had to do while we were building this program was develop big partnerships. And one of the big partnerships we developed was with King County Metro. And we wanted to make sure that all the different transit agencies, the services that they were able to provide were going to be accessible for our navigators to promote, as well as have the information and the resources to do that effectively. With the community local level of having King County Metro be on our side, we were able to get a lot of resources. Our outreach materials and resources all come through King County Metro, which is one of the big 3 transit agencies of our county. And we wanted to co-create this program with King County Metro to see what different types of programs can we create, what feedback are we hearing about the current services and what the ridership looks like, and specifically, what is the feedback like from this specific target community that has been underserved previously in the past. And one thing that we also wanted to be very mindful of too is the cost efficiency. And we wanted to make sure that we were able to get enough funding from King County Metro and provide flexibility into this program, as well as creating sustainable long-term impacts. And with King County Metro, they have been able to provide a lot of those services for us and be very bought in and invested in the CTN program. CTN stands for Community Transportation Navigators. And if you want to go to the next slide, Sarah, I can talk a little bit about the Health Through Housing site on-site staff. So Hopelink and the Navigator program work really close with the healthier housing staff to ensure that the housing site has exactly what they need to serve their residents. And this partnership allows us to be very collaborative with the case managers because each healthier housing site is so different. We have two different housing sites that we serve. One is permanent supportive housing, and the second is emergency housing. So the needs at the permanent supportive housing sites may look very different than the ones at the emergency housing site. And we're able to accommodate that by building these relationships with the staff and trying to find the resources that's going to fit their needs the best. Some things that we have done in collaboration with the site on staff is creating outreach events and resource fairs where we're able to bring in other vendors to come and join us for tabling sessions. Where if the resident is unable to travel to these other essential needs, we're able to invite and build partnership with those resources and bring them into the healthier housing sites themselves. And that builds a lot of trust and relationships for the residents where they're able to access services on site. And for some resources that are too far away for them, they're able to get that as a direct services. The staff members at Healthier Housing Site are there more often than our navigators, so they're able to do direct referrals to our navigators and kind of provide case notes or recommendations of people who they think might be needing some transportation resources and that one-on-one peer-to-peer support. And the other factor that Healthier Housing staff have really helped us is sometimes when there are application process that we are looking to sign people up, the residents may not have access to their documentations, but those documentations are stored with the staff for the enrollment process of getting into this permanent supportive housing or emergency housing. So the navigator can touch base with the staff to also safely retrieve those documents and submit them in a safety portal so that the navigators can help residents sign up for reduced fare services. And then, Sara, do you want to talk a little bit about other advocacy programs that we partner up with to just build program awareness?
Yeah, thanks, Sandy. And I want to be mindful. Hopefully, we can get through all the slides, but we can also hang out for a few minutes and answer questions if folks have them. You're also welcome to pop questions in the chat, and we can try to answer those as well. And so one of the great things about this is we now have this creates an on-the-ground connection to these communities whose voices might not also be represented on local mobility boards, in different planning agencies, and kind of this partnership brings the voices of hardest reached communities into the forefront. And so we've had navigators who've served on transit mobility boards that have worked with and supported our University of Washington Taskar Center for Accessible Technology. They worked on a sidewalk project. We partner with Alta Planning and Design we're doing a universal basic mobility wallet. And so they've had an opportunity to work with a consulting firm. And really what we're doing is we're saying, not only are we serving these communities, but we're also listening to what these communities need. I think one of my favorite examples is one of our navigators. You saw his picture, Lester, and unfortunately due to health reasons, Lester's not with us anymore, but one of his greatest accomplishments is not only did he serve on our South King County Mobility Board, but he identified that some bus stops and some services didn't make sense for one of the communities that he was serving. And he kept bringing it up to Sandy, and Sandy kept bringing it up to King County Metro. And over time, we just kept mentioning, hey, this bus stop doesn't work. This bus stop doesn't work. There's a new bus stop that exists and this is a very simplified version of this story, but like the bus stop now exists to better serve that exact community. And so it's a two-way street. We're providing compensation and a job opportunity. They're providing us feedback. And ultimately what happens is increased ridership on public transit, increased safety, and an increased commitment to better serving the community. And so it's really a mutually beneficial relationship between ourselves, a transit agency, and these communities. And we're really excited to see, like, I think someday we'll get out of recruitment and all of the things that we're trying to do and really get deep into operations. I'm hoping later this year. And I think we'll be able to find even more of these opportunities as transit just continues to rapidly change. So I'm going to go to the next slide, and we'll hear from Ryan.
My name is Ryan Kinchelow, and the way I got connected to the program, it was sort of a person-to-person networking. My brother was volunteering at a place where the King County Regional Homeless Authority was doing a point in time count, and he referred me to a social worker that knew of a cool job, and I was studying human resources at the associate level at the time. And so she gave me our program manager's email, and I just was persistent because I knew that I would be a great fit for the program, and it was a really exciting, innovative program to be a part of.
What types of recommendation you would make to someone doing engagement with your community?
So I could only really speak what works well for myself. The idea of interfacing with the community and being prepared with the subject matter, the content, and sort of the objective of why we're there is very important. But I think there's another element of it that should have like a parallel importance that should be just as important, and that's just showing up as a person to support people and just to be there as a peer and as a member of the community, and just know when it's about providing information and resources, and know when it's just about being present and available.
All right, we're going to listen to Randall, and then we'll go. Sorry, it takes just a moment to load. All right, and here's Randall.
My name is Randall. I'm a community transportation navigator for Hopelink. I service the sites in South King County.
Randall, what types of recommendation would you make to someone doing
Sorry.
engagement with this community?
Well, anyone who's dealing with people who are being rehoused or newly housed, I feel should always have considerations of the things that people may have been going through and is still going through. Everyone goes through a process, so just having a trauma-informed approach, keep being mindful of the things that may set someone back, or the things that may be easy for you or regular or normal to you might not be the same for someone else. The ways people engage and speak with people may not be the same as what you're used to hearing. Some people you have to work with several times before they kind of understand what's going on based on their personal experiences.
Just an opportunity to hear from some of our navigators in their own words. And then Sandy's going to finish this out in the next few minutes, just talking a little bit about data.
Yeah, thanks, Sarah. And hopefully you all got to learn a little bit more about some of the navigators that serve these healthier housing sites that you see on the board here today. And these are a data collection of encounter forms that navigators are able to document anytime that they encounter a resident on site. They're able to learn and understand what types of needs and information residents are looking for. So in this quick snapshot of all the different topics that they can talk about or support is addressing safety concerns, how to support with trip planning, how to navigate Orca cards, how can they ride the bus, how can they use light rail or different other micromobility and transportation options. So this is a large screenshot of all the different topics covered amongst different sites. Some sites are smaller than others. Some sites are emergency versus permanent supporting. So having that context will also show you the data where things are located and what are the most frequent topics discussed. Sarah, if you want to go to the next slide. And then this is a dashboard of showing different outcomes that have happened over time. Usually our goal is that the navigator is consistently returning on site on a weekly basis, where they can either support someone on a one-time basis or multiple different times. And we're hoping that after the first, the second, or the third time working with our navigators and doing some one-on-one trip planning or support, that we're able to have self-reported outcomes of things that are changing within their behavior for the residents. And at Bertha Pitts Campbell, this is one of the permanent supporting housing sites. And I'll go over the top 3 most reported outcomes is taking some type of new transportation after meeting with our navigators. So 27 people self-reported that they have been taking a new mode of transportation since they've met the navigator. 26 people have self-reported that they're using transit more now that they have all these information and resources. And the third one that's most popular, that's a self-reported outcome, is arriving to appointments on time. And our goal is that hopefully that people are learning all the different services that they can use specifically to get to medical appointments so that they can arrive on time and receive the treatment that they need to, have healthy lives. And then, Sarah, if you want to go to the next slide, we'll show another housing site. This is North Star. This is in North Seattle. And this one, the top 3s are very similar, but they have slightly different outcomes of how many people have been reporting them. At North Star, we have about 32 people who are self-reporting that they're using transit more often. 14 people reported that they are taking some type of new transit mode. And then very similar to the other housing site, 11 people have self-reported that they're arriving to appointments on time more often. I also want to highlight the 6 people that self-reported that they got a job after learning all these different type of transportation information. And oftentimes this helps the residents at the early stages of getting to their interviews and making sure they're able to get to their interviews on time. And then once they get offered the job, our navigators work with individuals of making sure that they have a plan to get to and from work on a consistent basis. How would they pay for transportation? Which routes are going to be most effective? And then we have a couple more housing sites to share as an example, but these will be emergency sites. So Sarah, if you want to go to the next slide. So when we're looking at the emergency house, this is Gateway. This is one of our bigger sites, and it is also in North Seattle and North King County. A couple that we wanted to highlight here is top 3 self-reported outcomes are using transportation more often, taking a new type of transit, but there's also 25 people who self-reported that they feel a way more confidence and a higher confidence level riding transportation. And maybe that is because they now have an Orca card where they can pay for it and they can ride on the bus and feeling very confident that they can pay and contribute to the cost for that. Maybe they know which routes they can take more often or taking a different mode of transportation as well. Trip planning is also another one that people have self-reported a lot, as well as shared the transit services with other people who might not live in that same building, or they also can share information with their friends and family. So that's where that 16 people have shared services with other residents or other family members outside of the program. And then we have one last slide just to compare data points again. This is an emergency site in North Seattle, and very similar, the top 3 here is 9 people reported that they're able to use transit more often. 6 people reported that they're able to use trip planning tools to get around and make their trip planning more efficient after working with navigators. And then 5 people self-reported that they feel more confidence riding transportation. And then one other one just to highlight is there is one outcome where actually 2 outcomes where people have applied for transit services where they have to go through an application process. And one of the examples that we help people get signed up for is King County Metro's paratransit, and that program is called Access, which requires a in-person evaluation as well as a paper copy application. And our navigators have worked really hard with residents and collaborated with case managers to make sure that people are able to get on those services and programs based with those eligibilities. And that is everything that we wanted to share for our program today. We are really excited to all the new future outcomes that are coming soon. And we recently launched the Universal Basic Mobility Wallet. So hopefully in the future, we can share some data of how that program is going with this specific target community. But I think the most important thing we want to leave you all with is having a program developed and invested in community members who are providing the education have really transformed the community's ability to ride public transportation. And we think it's a really strong model to replicate. And we're really excited once the team becomes full-time staff, the greater depth of impact that we can create together with our navigators and value their lived experience. So thank you everyone for joining in today.